Which epileptic syndrome is associated with left hemispheric atrophy in child? A. Dravet syndrome. B. West syndrome. C. Lennox-Gastaut syndrome. D. Dyke-Davidson-Mason syndrome. Well, David syndrome, West syndrome, Lennox-Gastaut syndrome, these are all epileptic syndrome. But now let us see Dyke-Davidson-Mason syndrome. Dyke-Davidson-Mason syndrome has childhood cerebral hemiatrophy. Other features of Dyke-Davidson-Mason syndrome are hemiatrophy or hypoplasia of unilateral cerebral hemisphere resulting from CNS insult in fetal or early childhood period with compensatory ipsilateral calvarial hypertrophy. The insult should be vascular, congenital, or acquired, ischemic disease, trauma, or inflammation. In utero, gestational vascular occlusion involving middle cerebral vascular territory and coarctation of mid aortic arch may decrease the carotid arterial flow. So it is Dyke-Davidson-Mason syndrome. A 5-year-old child has recurrent infections, low platelet count, rash as shown below. What is the likely diagnosis? A. Severe combined immunodeficiency. B. Jobs syndrome. C. Bruton's agammaglobulinemia. D. Wiskott-Algich syndrome. Eczematous rash, thrombocytopenia, immunodeficiency, that is recurrent infection, are the features of Wiskott-Aldrich syndrome, an X-linked recessive disorder due to WAS gene mutation on chromosome XP11. It is Wiskott-Aldrich syndrome. This is a X-linked recessive disorder. Eczematous rash, thrombocytopenia, immunodeficiency. Which of the following scoring is done to assess respiratory distress in neonates? A. Cribs score. B. Apgar score. C. Silverman-Anderson score. D. SNAP score. Now, what is Cribs score? Cribs score is Clinical Risk Index for Babies score. It is a tool for assessing the neonatal risk and comparing performance of neonatal intensive care units. CRIB2 square is a validated measure of initial mortality risk and illness severity within 1 hour of admission. It takes into account birth weight, gestational age, body temperature. Then SNAP score. SNAP score is score for neonatal acute physiology. That is SNAP for babies of all birth weights. Then Silverman-Anderson score for respiratory distress. So the correct option here is Silverman-Anderson score. Which of the following genes is implicated in pathogenesis of juvenile myoclonic epilepsy? Juvenile myoclonic epilepsy has been linked to mutation in many genes, including CACNB4, CLNC2, EJM23, GABRA1, GABRA-D, myoclonin 1, EFHC1. So the correct option here is GABRA1. True about Fragile X syndrome is a triple nucleotide CAG sequence mutation, 10% female carriers mentally retarded, males have IQ 20 to 40, D gain of function mutation. Males have IQ 20 to 40 is the correct option here. Triple nucleotide CAG sequence mutation, it is wrong. In Fragile X syndrome, CGG repeats are seen, not CAG sequence. Mental impairment with retarded or borderline IQ occurs in 35% of carriers, not 10%. So second one is also false. There is a, so the correct option here is C. Males have IQ of 20 to 40. Which of the following diseases these X-ray findings is seen? A. Gaucher's disease, B. Fabry disease, C. Markey disease, D. Niemann-Pick disease. Here you can see peg-shaped metacarpus and rounded vertebral bodies with anterior beaking. So this is characteristically seen in Markey disease. In which of the following disease the skin rash shown in the picture is seen? A. Multiple carboxylase deficiency, B. Biotinidase deficiency, C. Alkaptonuria, D. Hartnup disorder. It is Hartnup disorder. An 8-day-old neonate presents with hypoglycemia, glucose 17 mg/%, and jaundice is diagnosed to have metabolic disorder. Most likely diagnosis is galactosemia. Identify the disease in child with violet-colored rashes, eyes, and hands. It is Kawasaki disease. Identify the device used in resuscitation. A. Pulse oximeter, NIBP. It is a defibrillator. AET CO2 monitor. It is a defibrillator. A 2-month-old baby with central cyanosis presented with following findings on chest X-ray and ECG. What is the most underlying diagnosis? A. Tetralogy of Fallot. B. Hypoplastic left heart syndrome. C. Coarctation. D. Epstein anomaly. It is Epstein anomaly. The skin lesions shown in picture are seen in which heart disease? Eisenmenger syndrome, rheumatic heart disease, infective endocarditis, C. Heart failure. It is rheumatic heart disease. The following X-ray picture is seen in which congenital heart disease? It is TAPVC, portal anomalous pulmonary venous connections. Which congenital heart disease is associated with the child condition? It is ASD, atrial septal defect. Luton-Bacher syndrome comprises of atrial septal defect with mitral stenosis. Can give the figure associated with. It is Fanconi's anemia. Manifestation of thalassemia. It is a polycystic kidney. Preterm neonate is 500 milliosmol per liter. In children, the most common complication is severe malarial anemia. Superior rib notching is seen in all. A. Osteogenesis imperfecta, B. Neurofibromatosis, C. Marfan syndrome, D. Coarctation of aorta. Coarctation of aorta. In coarctation of aorta, inferior rib notching is seen. Abnormality given in the peripheral smear. It is sickle cell anemia. Here you can see sickle cells. Poor prognostic indicator of ALL is A. Female sex, B. Leukocyte count less than 50,000 per microliter, age greater than 1 year, hypopaladic.